Good afternoon, everyone. Today I am going to present the case of retinal artery macroaneurysm, an uncommon manifestation of radiation retinopathy. So, a 33-year-old male presented with sudden painless diminution of vision in the right eye since 2 days. He had history of radiotherapy to the right side of the skull 17 years before for brain tumor, and which was in a complete remission now. He had no history of any systemic illness. On external examination, it showed right temporalis muscle atrophy. On ocular examination, his best corrected visual acuity was 6/36 in the right eye and 6/6 in the left eye. Anterior segment examination of the right eye showed punctate epithelial erosions, corneal filaments. Shermer test was 7, and it showed posterior chamber intraocular lens, and fundus showed vitreous and pre-retinal hemorrhages obscuring the fundus view. Left eye ocular examination was within normal limit. So at this point, we advise patient to maintain the restricted activity and review after 2 weeks. So 2 weeks after presentation, right eye showed regressed vitreous hemorrhage. There were subretinal hard exudates along the superior-temporal arcade. Left eye was normal. The fundus fluorescein angiography of the right eye showed microaneurysms over the posterior pole with the leakage of dye along the superior-temporal arcade, likely RAM. And OCT, we did the OCTA to rule out any neovascularization. OCT showed presence of pre-retinal hemorrhage, which was obscuring the retinal details. At this point, we gave intravitreal anti-VEGFs to the patient, and 1 month post-injection, his visual acuity improved to the 6/6, and fundus showed resolved vitreous and pre-retinal hemorrhage. And OCT, we can see a round cavity with hyperreflective wall and a dark lumen suggestive of RAM. So probably that vitreous hemorrhage was secondary to the RAM. So the second, in case 2, a 67-year-old male came for routine examination. He had history of intravenous chemotherapy and radiotherapy to the right side of the neck 6 years back. He had no history of any systemic illness. On external examination of face, it showed torticollis and neck stiffness. His best corrected visual acuity was 6/9 in the right eye and 6/6 in the left eye. Anterior segment examination of both eyes were normal. So on fundus examination, right eye showed microaneurysms over the posterior pole, left eye was normal. FFA of the right eye showed microaneurysms over the posterior pole, multiple CNP areas in the periphery, left eye was normal. At this point, we advised sectoral laser to the CNP areas. Then patient lost to follow-up, and he presented 1 year later with diminution of vision in the right eye since 2 months. On ocular examination, his BCVA was 6/60 in the right eye and 6/6 in the left eye. Anterior segment examination of the right eye showed NS2 cataract. Fundus showed retinal artery macroaneurysm along the superior-temporal arcade with subhyaloid and subretinal hemorrhage. And peripheral retina showed laser scar. Left eye was normal. This is the fundus photo showing subhyaloid hemorrhage. So OCT showed pre-retinal hemorrhage, and there were intraretinal hyperreflectivity along the superior temporal vessel suggestive of RAM. So at this point, we have advised phaco with vitrectomy along with the intravitreal anti-VEGFs. 1 month post-surgery, patient showed cystoid macular edema and RAM with minimal SRF. So at this point, we have advised intravitreal triamcinolone, and after triamcinolone, at this point, we advised triamcinolone along with the focal laser to the RAM. So after 1 month of IVTA and focal laser, OCT showed resolved CME. So radiation retinopathy is a frequently encountered complication of radiotherapy for ocular and periorbital cancer. It is influenced by the dose, duration of treatment, and concomitant systemic factors. Intracranial aneurysms following radiotherapy for the head and neck cancer has been reported, but retinal artery macroaneurysm after radiation retinopathy has never, but RAM in a radiation retinopathy has never been reported before. In our case, patients with history of radiotherapy, clinical and imaging characteristics in the absence of any systemic illness rendered RAM secondary to the radiation a likely diagnosis. Treatment of RAM include laser photocoagulation, intravitreal anti-VEGFs, and PPV. Thank you.